Hi everyone, welcome to Barely Strong. Today we'll be discussing lower back pain and sciatica. But just quickly before we get into it, if you haven't subscribed yet already, we would love to have you. So hit the subscribe button so you know when future videos are coming out. Now, lower back pain and sciatica are common issues for a lot of pregnant women and a lot of the general population. Lower back pain is generally characterized by pain in the lower back region, whereas sciatica is normally a sharp shooting pain felt in the buttock, the hamstring, or the calf region. And the causes for both of these conditions are generally or often quite similar, and so the treatment tends to focus on similar aspects. You really want to focus on loosening up some of the muscles in the buttock and the lower back region. Focus on exercises that restore mobility or movement to the lower spine and hip region. And then long term, you also really want to concentrate on building up your core strength and stability. And you can find some really great core exercises for pregnancy in our 10-minute workouts. So we'll go through a few exercises today that you can try at home if you're suffering from low back pain or sciatica. The first one uses a tennis ball or something a bit bigger and harder like a softball. And we'll use this to massage out some of the tight muscles in the buttock region, particularly the piriformis, which can contribute to sciatica. So we're going to take the tennis ball and put it in the middle of the buttock, in the meaty region, and put our weight onto that. We'll start with rolling around on the ball, trying to find the tender and tight areas. You'll know that it's the area that you should focus on if there's a little bit more pain there or it feels a little thicker, but you don't want to be feeling any sharp shooting pains down the leg while you're doing this. After you've rolled around for a bit, find a tender spot, maintain pressure on that area as you let the knee fall out to the side and come back in. So now we're integrating some joint movement as we maintain pressure on that muscle. After you've done that 4 times, open the foot out and then drop the knee inwards. In 4 times. And you can repeat this sequence a few times for 1 to 2 minutes. After we've done that, we'll do a little bit of stretching in the area. And for this, you lean back onto your hands, cross that leg over its opposite knee, and then sit up nice and tall, trying to open that knee out until you feel a stretch in the glute area. You can also do this sitting on a chair, keeping the back straight and leaning forward. To increase the stretch, you can drop that knee over across the body ever so slightly. And you'll want to hold this for about 15 seconds. Then back off, release the stretch for a bit, and then repeat. So for all of these exercises, start off with short durations and small amounts because you don't want to aggravate anything, and then build up. If any of these exercises aggravate or increase the pain afterwards, you'll know you've done too much. We'll then move down to a lying position to focus on some lower back mobility. You can also do this sitting in a chair if it's difficult to lie on your back. And the movement here is quite simple. We're just tilting that pelvis. So rocking it forward and back as we arch the back and then push that lower back into the mat. And you really want to make sure that this movement is just happening at the lower spine and not the entire back. We want to focus that mobility into this region. And you can do 15 to 20 of these pelvic tilts, and it's an easy movement to do throughout the day when you have a spare moment standing in the kitchen or brushing your teeth. And if things are really aggravated, focus on the direction that relieves or that doesn't increase your symptoms. So if it's really painful to arch your back, then focus on tucking the pelvis under and coming back to neutral. And eventually, as the pain gets better, you can push into that arched position. Another movement that we want to do to restore mobility to the lumbar spine or the low back is rotation. So you'll bring your knees and your feet together. Arms can be beside you or out to the side, and you're dropping the knees to one side, bringing them back up and then dropping them to the other. If your symptoms are quite severe, the general rule of thumb is to start with the least painful movement or the movement that doesn't cause any pain. So often dropping your knees away from the painful side. So if my right side is painful, I'll drop my knees towards the left side and come back to neutral. And as symptoms get better, I'll start going towards the painful side. But this really opens up the lower back and helps to relieve pressure on some of the nerves that exit through the low back. You can also increase this stretch by bringing one leg up and dropping it over the body into this position, and that will put a bigger movement or bigger rotatory movement on that low back. So after you've done this, maybe 8 to 10 times each side, the last one is focused on getting the nerves moving through the back and the legs. So what you want to do is bring one leg up towards the chest, often the painful side, straighten out the bottom leg, toes up to the ceiling, and you're stretching the knee or extending it then bending it. And what this is doing is it's moving the nerves up and down the leg, because with sciatica often the nerves are affected, and by exposing those nerves to a little bit more movement, it helps with the pain. Up and down. You can also do this sitting in a chair, or you can even do it in a kneeling position. And we don't want to do this one too much in case it aggravates. So 8 to 10, and then you can have a break and repeat that again. So these are some easy exercises that you can incorporate into your routine or throughout your day if you're suffering from low back pain or sciatica. If things just are not getting better, I'd really encourage you to see a physiotherapist for an individual assessment and treatment program. But here are some things that you can try to start with. Just a reminder to join us and subscribe if you haven't already, and check out some of our other videos that are out for this week. I'll see you again soon on Belly Strong.